Hey everybody, welcome back to the Dr. Terri Show. Today's episode is one I've been wanting to have for a while because we're talking about something that's becoming more common and more dangerous by the day. The rise of unqualified imposters in the plastic surgery aesthetic space and how it's putting women at risk. Here's a reminder. Plastic surgery is still surgery. It's not just cosmetic. It's not just on the surface. It carries real risk, including disfigurement and even in the worst cases, death. If you're in the hands of someone who's untrained, uncertified, or just in it for the cash, that could be a problem. In this episode, I sit down with Dr. Lindsay Tavakolian, a board-certified plastic and reconstructive surgeon who's calling out the chaos and helping women make safe, smart, empowered decisions. Dr. Lindsay's the real deal, and she brings a level of compassion and depth and wisdom to her work that goes way beyond the operating room. We're going to talk about why choosing a female surgeon can make a major difference in your experience and outcome, how to spot red flags in today's saturated, cash-driven aesthetics market, when surgery isn't the answer, and why sometimes the most powerful thing you can do is pause and reflect. The truth about skin health and why no cream, laser, or filler will ever fix a broken foundation. The real deal on tallow, hormone creams, and other skin trends, including what works and what doesn't work, and what might be doing more harm than good. How Dr. Lindsay is supporting breast cancer survivors in rebuilding more than just their bodies. And yes, we are busting myths today, from estrogen face creams to quick fix procedures, because you deserve better than this beauty bandwagon. This episode is honest, it's eye-opening, and packed with wisdom for any woman considering a procedure or just wanting to better understand her skin, her hormones, and her options. Let's get into it. Here's my conversation with the incredibly insightful Dr. Lindsay Tavakolian. All right, Dr. Lindsay, welcome back.
Thank you.
Thanks for being back. Okay, I'm excited to continue our conversation. There's a lot more to talk about. But the first thing I want to talk about is this idea around imposters in the industry, in the plastic surgery world. And there are so many women, and I'm so glad I know you now, because I have relationships with some amazing male plastic surgeons.
Right.
But a lot of women want a woman. And so let's talk a little bit about that. Why a female, and some of this kind of imposter, syndrome in the industry, if you will.
Well, let's start with the imposters, and then we can talk female.
Okay.
Imposters, there are a lot of people who, to put it crudely, they want a piece of the pie.
Yeah.
They see plastic surgery not as a calling. They see it as a paycheck, because they are cash pay procedures most of the time. And so from a business standpoint, they want a piece of the pie. Or they want kind of that sexy title of like being a plastic surgeon. And for me, it's all wrong motives. And so from that, you will get internal medicine doctors, emergency medicine doctors, OBGYNs. There have been some famous ones who have operated on famous people who were never trained in plastic surgery. And this is why it's really important to make sure that your plastic surgeon was actually trained in an ABPS governed program that taught them plastic surgery.
Yeah, I have a horror story of a patient, exactly this. She decided, her OB-GYN had brought in a lot of aesthetic technologies and liposuction and things like that. And she decided to let him do her liposuction, and it was a disaster. And she actually almost died. So thank goodness she did it.
Right.
But that's an example of what we're talking about, I think.
Right. It is. And I think it's important to emphasize that plastic surgery is still surgery. And it's still something that can kill you if not done properly. Yeah. And you need somebody who has spent, like I did, 6 years of my life understanding the anatomy and also studying the human body, how it responds to surgery, the specific surgeries, understanding technique, learning that technique from the masters of the trade, not from somebody that I paid myself to go and get a fake fellowship from that lasted 12 months to kind of get an idea of how to use a liposuction cannula. A real education program teaches you from the ground up with graduated autonomy how to approach each surgery and keep the patient safe.
Yeah.
Things that somebody who's not trained in the field may not pick up on is it's actually really dangerous to do high volume liposuction.
Yeah, the fluid shifts alone. I mean,
Yes.
coming from acute care, this is
Yes.
like a logical thing to me.
Yes. But people who were not trained in the program
Right.
and who have not been taught all of these very fine, detailed points that we're tested on yearly and then in our board exams, we have to know this stuff. We know it when we're walking into the room to see you as a patient. In our mind is a whole list of ways that I could kill you if I did it wrong.
That's right.
So that I can keep you safe.
Yeah.
So what's the problem when somebody who says, well, I am a surgeon, I am a general surgeon, or I am an OB-GYN, so why can't I just do liposuction? It's easy. It's cosmetic. Well, it's because you don't know what you don't know.
Right.
And you don't know all the ways that I'm trained in to understand how I can kill you and disfigure you
Yeah.
if we do this the wrong way.
Yeah, no,
and it
that's
can be as simple as giving you too much fluid in the operating room. It doesn't seem deadly, but it can be deadly. So moving from making sure that your plastic surgeon is a real plastic surgeon and not an imposter who's just money grabbing into female plastic surgeons.
Well, can I add one thing to that also
Yes.
that is interesting is it's an art. And, you know, I agree with you. If I am, you know, certified in some form of medicine and I really am passionate about the art of plastic surgery, then go add on a real fellowship of plastic surgery for, you know, 4 to 6 years and then do that.
it. Be trained.
Yeah, be trained.
Go get the training.
For safety, if nothing else, yeah.
That's a good point because people will sometimes say, well, why didn't they go and get trained? Because it's one of the hardest specialties to get into.
Right.
Because I had to study and spend more time in the library than I did with my family and my friends to get there. And they either didn't set aside that time to do that and to make it into the hardest specialty to get in or one of the hardest specialties to get in. But maybe they realized later in life it was better money. Still not good reasons to avoid real training.
Yeah.
And so if you come by it honestly, it's a really big sacrifice of your own time to put into the training.
Well, and I'm even seeing, you know, different med spas pop up where, you know, there's questionable training and they're doing some pretty intense procedures. I mean, even in our clinics, we do Botox and fillers and things like that. But that's kind of where I draw the line. You know, I've had, you know, nurse injectors say, oh, let's do thread lifts and let's do this and let's do that. I'm like, nope. If somebody wants to get their face lifted, they need to go to a plastic surgeon.
Right.
And you're seeing, you know, butt implants and, you know, all these injections that are being done. And it just kind of freaks me out. It's like, people pay attention. This isn't benign stuff that's getting put in your body.
It's not. And what's missed by people who aren't formally trained are the things that can happen down the road too. Not only immediate risk to your safety, but let's just talk aesthetically. And so as a plastic surgeon, I know, and anybody who works for me is trained to know that what we do now will affect your tissues and how they're available later to me in surgery and whether or not they've been compromised or not.
Yeah.
So it's really important to have the long game in mind.
Yeah.
I'm an example. I'm very conservative with under eye talks. And this is because I have a really heavy respect for the integrity of the lower eyelid because I know that it's a structure that can be really compromised later on. You lose laxity in it as you age. It tends to droop as you age. And oftentimes when I'm doing lower eyelid surgery, I'm depending on that elasticity in order to help you heal properly without unwanted consequences that can put your your actual eye in danger.
Right.
And so somebody who just set up shop and said, what harm can it cause? It's just an injection. And they don't understand that they're chipping away at the integrity of a structure that's really important for your functional and aesthetic wellness later on in life. That's the difference between people who have the training, have the understanding, and have the oversight, and people who don't.
Yeah, that's so good. And I want to move on to the conversation of female surgeons because, you know, like I said previously when we started this conversation, I have some amazing friends and surgeons, plastic surgeons that are male, and they're awesome.
Yes.
But I get asked frequently in my clinic do you know a female? I'm glad to know one now
Yes.
for referral
Yes.
sources. But talk a little bit about that.
So I came to plastic surgery, honestly. I became interested in plastic surgery because I actually needed plastic surgery when I was younger. And I needed plastic surgery on my breasts. I had asymmetry. And so I actually had breast surgery to correct that asymmetry. And it was one of the best, most transformative experiences of my life. That history for me, combined with a passion for women in general. I have a passion for women's health. I have a passion for advocating for women. I have a passion for advancing the field of making care and overall wellness and plastic surgery safer and more women-centric and focused.
That's good.
Let's talk about how men sometimes fail women when men are taking care of women. And this is some men, not all. Some of them fail to listen. They have a natural lack of true empathy, understanding what it's like to have breasts, understanding what it's like to have a uterus and have labia and have a tummy that's, a female tummy affected by hormones, estrogen changes. These sorts of things are frequently lost on men. And so when you go to a female plastic surgeon, not only are you getting somebody who's technically trained, like the men are, but you're getting somebody who can fully empathize with your body parts, your hormone makeup, the troubles that you face as a woman. And when I am advising women about how to go through the process of surgery, I'm thinking the whole time, well, how do I feel about this?
Right.
How would I feel as a woman recovering with this?
Right.
How do I feel about this entire scenario and my trade-offs? And I think that I can help counsel them in the truest form because I can empathize with them as a woman wholly.
Yeah. So I love what you're talking about. And I want to talk about hormones because they play such a huge role in what you do. But what prompted you down this kind of integrated mindset to what you do? Because again, I said it previously when we were together, it's such a refreshing, different approach to aesthetics, but there's got to be a story there.
Great question. I'm not sure what instilled it in me. But before I went to medical school, I actually obtained my master's in public health.
Oh.
Because I always had a driving passion for what are the things that actually contribute to health on a population level? What are we eating? What are we drinking? What are the schools feeding our children? What are the toxins in our environment?
We have a whole conversation about that. Yeah.
What's genetically programmed into our DNA that makes the difference between men and women different in their health outcomes, the difference between black and white and their difference in their outcomes. I have always been interested in all determinants of health at a population level.
So from social on over, I would imagine.
Absolutely, to sex. So we're talking, the difference between men and women has now become one of my most passionate areas of my public health focus because I'm so passionate about women. And I do plastic surgery on men too, but my real super passion in life is helping women and helping them feel better about themselves. And I don't think that starts and ends with surgery. So as a physician, I'm a fixer, right? We often talk about, well, why didn't your doctor tell you to do this? Or why didn't your doctor make you healthy? Why is he just fixing your problems? Why is she just fixing your problems?
Or band-aiding
your
problems.
Yes. And so I think of myself as having, it's not really a dichotomy because it's really a synthesis of two passions. It's really holistic. I'm a physician in that I fix people with surgery. I see a problem. It's a definable problem. I take them to the operating room and I fix that problem. But then as somebody who has expertise in public health, then I also care about all the determinants of health in that person. And I don't think that those two live separately.
Yeah.
And so I'm educated in both. I'm trained in both. And I worked in the public health sector for 5 years before I ever went to medical school.
Yeah.
And so my perspective is just very much informed by being entrenched in that public health sphere. Why did I go into it? I don't know. I wanted to. I was passionate about it.
Yeah, that's
I don't know what instilled that in me.
What a great foundation, though, for and that had to have shifted your whole experience of and development into the physician that you are today. I mean, that's great. I knew there had to be a story there. So let's talk about also. There's another piece that is related to this. It's related to a holistic approach. Is this mindset, this mental, spiritual approach to your work? Talk a little bit about that and what that means to you as well.
Well, my approach to my work, again, is more about helping women. Mm-hmm. It's not so much just defined by the operations that I do. I seek a lot of reward and value in life in the work that I do. Mm-hmm. I feel called to my work as opposed to picking it off a list of things that I thought would be cool to do or I thought I could pull off. Mm-hmm. I have always felt a very strong calling, specifically to plastic surgery. I knew I would end up in plastic surgery even when I was pursuing public health. And for me, it's more being able to give back to women on a level that transformed my life. I know how much plastic surgery transformed my life in a way that wasn't just that surgery. It gave me confidence. It fixed a problem for me. It did something for me that is not just purely definable by a surgical procedure.
Yeah, that's good.
And so my entire approach to my practice is to be an advocate for women for their overall well-being. And so that's kind of I connect with so many women in clinic and we talk about so many different things, not just the surgery. And I always try to be on the lookout for something that may be missed with another doctor so that when women come under my care, they are finding an advocate.
Well, and this mental health piece of it, I think, is important and probably something that might be a little bit missing in your field with assessing for that because, I'm not probably going to say it right, but the Barbie syndrome or patients that keep doing things and adding things when the root cause isn't really about how they look. Right. It's more about their really their mental health and their, what's going on at the root cause. It's causing you to want to continually change yourself over and over. I mean, do you see that as something that is really important to pay attention to?
Very much so. A conversation that I have very frequently in my clinic is about body dysmorphia.
Yes.
Without doing a formal screening tool, in my mind, as I'm talking to somebody, I am screening them for body dysmorphia. Mm-hmm. I want to know, is their perception of themselves consistent with reality, or are they chasing something, or are they being influenced by a partner to do something?
Yeah.
And
I bet you see that a lot.
I do a lot. Mm-hmm. And it's tricky to deal with a partner in the room who says, well, I want her to have this done, or I want this cc of implant. And it's a tricky way to communicate with the actual patient and say, this is about you and this is about what you want.
Right.
This is not about what your partner wants. I tell my patients frequently, do not ever have surgery for somebody else.
Yeah.
And don't have surgery because even your doctor suggested it to you. A good marker for whether or not surgery is right for you. Do you wake up every day and think about the problem that you're wanting to get fixed? If it's a desire in your heart and something that really affects your life on a daily basis, then that's a good marker for wanting to have surgery. Now, how do I tell the person who is dysmorphic and their perception is not reality? A common tool that I use, if somebody comes in and says, hey, I want a rhinoplasty, I think I'm hideous because of my nose. And I'm looking at them and I'm thinking, there's some very small tweaks we could make, but this person has a nose that is well within normal, what we call normal limits of humans. There's nothing super that's going to grab somebody's attention when they walk in the room.
Right.
And so I ask them, rate your nose on a scale of 1 to 10. 10 being the best nose possible, perfect, 1 being worst nose possible. And if they're scaling that nose at a 1 or a 2, and I'm scaling them at a 7 or 8, I tell them they're not right for surgery. I tell them this is something that is they need to work on their mental approach to how they perceive themselves, and that work is done on with inner work, to be honest with you.
Absolutely. Yeah. And getting to the root of what wound, what trauma, what happened to cause you to look in the mirror and think this, about yourself. I love that. Moving on, we're talking about women and your focus on women. And obviously, that my focus is hormones, which is 70% of our patients are women. I even have seen this, when I started 16 years ago and dabbled a little bit in aesthetics with toxins and fillers, and then transitioned into learning more about hormones. I really kind of flipped my stance. And, my stance on it now is let's get all of your hormones optimized. Mm-hmm. Let's get your nutrition optimized. Because I think a thing that a lot of people don't understand is they want to address all of this stuff in their face, that a lot of it is dehydration, a lot of it is hormone deficiencies, there's toxic diet. I mean, it all shows up in your skin. So let's talk a little bit about hormones. And I know even for women that are transitioning through menopause and postmenopause, just how hormones impact, vaginal health and bladder health, because I know you work a lot down there too. So just give me your thoughts and your spiel on the whole hormone conversation as it relates to your industry.
So many of my patients are on hormones or should be on hormones. And I always look at their chart and I look to see what medications they're on. I think about what age they are. And I tell my patients that skin health starts from the ground up, right? Inside. It starts with the broccoli that you're eating when you're a toddler. And then as you move through life, you're very much affected by your hydration and by your diet and by your hormone changes. And so it's whether or not it's surgery or whether or not it's skincare, in order to get the results that you want and to see the changes that you want, you have to work on a molecular level first. Because it's the difference between me doing a remodel on something that has integrity and
that's a good
me
analogy.
doing a remodel on something that's falling apart and in
such
shambles.
Let's think about all the home makeover shows, they don't just slap up typically paint and, some, aesthetics on there. If the foundation is crumbling, you got to rip it back to the foundation and fix what the foundation is made of. I love that as an analogy.
And hydration and the status of your skin and the dryness and the texture, a lot of that starts with your hormone balance. Yeah. And so are your hormones balanced? Are you going through something in particular? Another example is, somebody who comes with pigmentation issues on their face. Is this a hormone problem?
Right.
We need to address the hormones because you cannot safely laser or peel somebody with pigmentation problems.
Right.
If the root cause is a hormone imbalance, you need to address that first at the root, like basic science level, with what you're putting into your body and how you're regulating it with supplements and with medications before you move on to doing procedures.
Yeah.
You will always get better outcomes, safer outcomes, and more predictable treatment when you're first balanced with hormones and with diet.
Oh, absolutely. Because, the thing with hormones is estrogen. There are estrogen receptors in the skin. And I always tell patients, if there is a receptor for a molecule on a cell, that molecule has an action in that cell. Right. So if there are receptors all through the dermal layers of the skin, and it plays a role in collagen, in elasticity, we're seeing a lot of, and I haven't seen any of these at work. I hate to tell everybody this, but there's this big trend of estrogen creams on the face for wrinkles and things, but I haven't really, because a lot of those are compounded with a really weak estrogen that doesn't really do what it needs to do. So I think they're expensive. And hey, and if anybody has found one that really works, let me know, because I'd be interested in it. But I've tried a few and I haven't really seen that really, really work as well. But you have to do that from the inside out. Laying a cream on top of your face that might have a little bit of estrogen and isn't really going to penetrate and get and do the work oftentimes that it needs to do. But also testosterone plays a role in skin hydration and oil production. Women lose testosterone starting in about her 30s. And so that's a big part of the conversation. And of course, progesterone, they all work synergistically in the skin. I think that's really important. Talking about hormones and women, and we have time, and I didn't know if we were going to have time to talk about it, but I do want to talk a little bit about breast cancer, and we'll have a bigger conversation about this later, but I want to touch on it because with breast cancer and breast reconstruction, there's a hormone conversation there as well. But what's your approach to breast cancer survivors? And, you had mentioned this kind of before we started, and I just want to hear what you have to say for our breast cancer survivors or people that are concerned about it or any of that.
Well, I think globally, you need to realize that when, again, we're looking at the woman as a whole, we cannot just look at breast cancer alone. We need to look at that woman's health overall.
Absolutely.
We need to think about cardiovascular risk, risk for colon cancer. We need to think about muscle mass. We need to think about how deadly hip fractures are.
Right.
And then we also need to think about breast cancer. So when we're looking at all of these things that hormone replacement can help women with effectively, reduce their risk for colon cancer, reduce their risk actually for breast cancer.
Yeah, no, that's
honestly.
It does. 2020 studies showed that. Yep.
And reduce your risk for bone problems and I don't know if people know this, but hip fractures have a really high mortality rate.
Yes.
It's really important to have hormone replacement for bone density. And muscle mass also helps contribute to your stability to make sure you're not falling and getting that hip fracture. Yeah. So we know that women overall, their risk for death is very much impacted by replacing those hormones. Yeah. Replacing those hormones will save women from a lot of very deadly things.
Absolutely.
So there's a lot of old misinterpreted evidence that says that we cannot give breast cancer survivors hormone replacement therapy. And while I always like to make sure that I can speak a little bit outside of my sandbox because I am a physician, but my recommendation for my ladies who have breast cancer, have had breast cancer, or have a really strong family risk of breast cancer is you should still be able to have hormone replacement therapy, but you need to be in the hands of an expert.
Right.
Again, just like plastic surgery imposters, there are also imposters who deal with hormone replacement therapy.
That don't understand it.
Yes. So you need to be working with somebody who knows the literature, who knows the updated literature, the updated interpretations of literature.
And I think that's the key right there. And that's where, when we teach and train clinicians, who has time? Who has time to sit and go through all the journal and a lot of the literature that I update our physicians in our network on aren't found in your regular everyday journals that are on your desk. These are annals of neuroendocrinology. I mean, who reads that, right? But I do. I mean, I find these studies.
So do I. But most people don't.
But, most people don't. But I love what you're saying about that is, and even in the fact that you even are up to date as a plastic surgeon on the latest hormone literature speaks to your passion for women's health, because one of the things that I know, and I'm learning this about you that is so important, is that you have to treat the patient as a whole person, mind, body, spirit, it all works together, and getting to the foundational root causes is, I love, love, love what you're talking about there.
Always seek an expert.
Yeah, you 100%. Same thing with plastic surgery. Same thing with hormones, with any specialty. What when you are consulting with a woman that might be in perimenopause or postmenopause and isn't on hormone therapy, do you recommend that they might add that to their prep before surgery?
I do.
Because of wound healing, I would imagine.
I do. So absolutely. Again, like you spoke to all the hormone receptors on the various components of the tissues of our body, the tissues that I operate on.
Right.
It's really important because there are actually some medically unwanted results that happen if you're not properly hydrated, just to speak in crude terms. So let me give you an example. If a woman is undergoing a labiaplasty and she's 20, we're not talking hormones.
Right.
If a woman is having a labiaplasty when she's she's perimenopausal, menopausal, then there are actually some complications that you can have that only come because of that lack of estrogen.
Yes.
So I'm telling them, make sure that you're working with your doctor or with your provider who's overseeing your hormone replacement therapy to make sure that you are either starting or augmenting your estrogen, at least, vaginally or by your vulva, whatever creams you're using. Make sure that that's a focus and that you're doing that perioperatively so that your tissues have a shot at healing.
Absolutely.
And then the same thing, to be honest with you, really goes, even if we're talking face and neck lift surgery.
Yep.
I prep the skin in ways that I say, use, tretinoin to maximize your skin health. But also, if your skin health is poor, one of my absolute favorite examples of how I teach my patients of how to think of the skin and the integrity of the skin is to compare it to Spanx. I have a newsletter, and I use this a lot in my newsletter. You're born with essentially Spanx, because every woman knows what Spanx is, right? You're born with Spanx in your skin. This is that tight elasticity.
Right.
Now, some people are born with a little bit less tighter Spanx than others, but the bottom line is that as you age and as you lose those estrogen tagging onto those receptors at the skin level, that Spanx starts to relax and some of it kind of breaks. Those are the stretch marks when the Spanx elasticity fibers break. And when you're older and you're getting ready for your first facelift, and by first I mean you usually need 2 or 3 to look like Kris Jenner by 70. Yeah. But when you're aging and you're losing that Spanx in your skin, what can we do to help tighten it and restore it and give it its best shot?
Yeah.
You want to do things like hormone replacement therapy, and you want to do things like tretinoin. These are all pieces of a bigger picture of, I can go in and I can pull your skin back and I can trim some off and make you tighter. But if your Spanx quality is poor, what's going to do? It's just going to kind of fall and relax afterwards.
Right.
If we strengthen the integrity of the Spanx through hormone replacement therapy and other skin creams, then we can actually help that skin, once it's stretched, stay where it is. And some of that's determined by genetics, and there's only so much you can do. Genetics are a hard one, but we really want to give you the best shot.
Yeah, that's good.
So the integration of making sure that you're undergoing the proper hormone replacement therapy, and then also doing things like tretinoin and proper skin hygiene is really how you're going to look your best and optimize the really big commitment of your surgery. It's a big commitment on your finances, on your time, on your recovery. And why would you do that in not the most optimized way?
Yeah, I love that. And, one last thing that I always want to kind of pop and get opinions on what's trending. And the thing I always tell my listeners is be careful of what you're learning on social media and social media reels.
Yes.
Because it's not always, there's crazy stuff people send me and go, have you ever heard of this? I'm like, that doesn't sound right. But there's this big trend, and I don't know, you may not even have something to say about it, but there's this trend of tallow on the skin.
Oh, no.
Tell me.
Oh, no.
We're probably going to get some haters that loved tallow. We might cut this part out, but I just need to know. I've been trying to figure out scientifically how this is beneficial. But anyway, what's your professional opinion on this trend of tallow?
My professional opinion is that it is a pore clogger. And so
that's what I would think.
I would recommend that I think the idea is that it's hydration. I think that's the intent, that you're going to hydrate your skin with this very occlusive thing. I would just say there's a lot of other better ways to do it, using products that have been proven to not clog pores. And so stick with your tried and trusty skincare lines. Yeah. Honestly, it doesn't even have to be expensive.
Right.
You can get good moisturizer from CVS. Yeah. Honestly.
Yeah. True.
There are some good brands. Don't put something on your face that is a pore clogger.
Right.
Because ultimately, for skin health, you do not want to clog your pores.
Oh, absolutely. I had a patient one time that she couldn't understand why her skin kept breaking out. And I finally said, because she thought it was the hormones. And I'm like, hey, we don't have your levels. It just doesn't make sense. And then I finally figured out she was using oil of Olay on her skin every night. Well, there's a lot of skin products that are targeted towards women, but towards women that don't have their hormones optimized. Right. And so when you have your testosterone optimized and your estrogen optimized and your skin is functioning properly, you're making oil for hydration internally. And then you pile all this oil on your skin. It can just cause problems. But I would, I've always been a big fan of skin products that have, vitamin C and things like that.
Those are essentially the pillars of good skincare. Yeah. You need vitamin C and you need a good tretinoin. And those two things plus SPF will get you a long way, as long as your hormones are also optimized.
Yeah, awesome. Well, thanks for being back again. And this was a great conversation.
Thank you.